Well, it's likely that you know someone in your life who has had breast cancer before. Well, just this week, the FDA updated new regulations ensuring that mammogram screenings include information about breast density. ABC Action News reporter Mary O'Connell today with those new rules and how they could save lives.
They're the words no one wants to hear from their doctor. You have cancer.
I was actually stage 2 when they diagnosed me. It was supposed to be slow growing. And within 2.5 weeks, it had doubled in size and turned me to stage 3.
In 2021, Ashley Lloyd was diagnosed with breast cancer at 36 years old.
I did about 10 seconds of crying, and then I was like, there are women all over the world that get this, and they're okay. And I'm going to be one of those women.
According to the CDC, about 1 in 8 women will get breast cancer during her life. Now, as of this week, a new FDA rule requires that patients' mammogram reports must include information on their breast density.
Some women have been getting notifications about their breast density, but it's not been standardized. And so that's the difference, is that now everybody's going to be getting the same information and the same notification.
The FDA says about half of women over 40 in the U.S. have dense breast tissue, which the agency says can make cancers harder to detect on a mammogram. On top of that, the FDA says dense breasts have been identified as a risk factor for developing breast cancer. Dr. Rachel Burke with Advent Health Tampa says don't skip your mammogram, even with dense breasts.
And that's why these letters are important, is to start a conversation with providers and with patients to say, by the way, you have dense breast tissue. It's important to know that because you might need additional screening.
It will help so many women.
Today, Lloyd is cancer-free. She's also the director of the Breast Cancer Foundation of Central Florida, helping provide hope and support to patients and survivors every step of the way.
You may think you're the only one. Well, who else would be diagnosed with this? Well, there's a support group you can sit in somewhere that will tell you someone has your exact same diagnosis somewhere, and they will hold your hand through it.
Mary O'Connell, ABC Action News.